we'd love to invite you to come sit down. We're going to get started very shortly. Thank you so much.
Good morning, everyone. Give you 30 more seconds to enjoy this beautiful morning before we get started. So good morning, and thank you everyone for being here. This is a very exciting day for us. My name is Nadia Brahms, and I have the honor of serving as the Acting Behavioral Health Director for San Diego County Behavioral Health Services. Several years ago, thank you. Several years ago, we embarked on a journey to develop a state-of-the-art facility designed to address the urgent behavioral health needs of the people in North County. And today, we are here to celebrate this new Psychiatric Health Facility, or PUF, we call for short, that will begin providing essential treatment services to people experiencing a behavioral health crisis. We are here because of our local leaders, partners, and county staff, including our Department of General Services, who have steadfastly been committed to improving access to care for people with mental health illnesses and substance use challenges. I'd like to first recognize some of the folks today who have been ongoing supporters of this effort. First, our North County mayors, several who are here today, and first responders. We have key leadership from our Health and Human Services Agency. I'd also like to acknowledge our county council team. I saw Caitlin here. Who worked tirelessly to get this partnership finalized. And of course, the Exodus and Tri-City medical teams who have helped bring this vision together through a three-way innovative partnership with San Diego County. It's a great example of what we can accomplish when we are all working together for the same goals. And though it's been complex and challenging, I'll admit that, we know that today this PUF will make a real difference in people's lives, especially folks that are living locally here. These new services are also expected to ease pressure on local hospitals and emergency departments because people will have tailored access to client-centered care to meet their behavioral health needs. Most importantly, it means that North County residents have access to crisis care that is close to home. Thank you again to everybody who played a part in this facility. And now it is my pleasure to introduce Supervisor Desmond.
All right, thank you, Nadia. North County, we need up here. This is so great that you're here today for the opening of the PUF here, the psychiatric facility for North County and all of San Diego County. Thanks for being here and being a part of this. This is wonderful. This is exactly what we need. We need more treatment facilities like this. I've been a big advocate for treatment. It was when I first got elected county supervisor. I remember Tri-City Hospital unfortunately had to shut down their crisis stabilization unit and their psychiatric unit. And that was in 2018. In 2019, it was, I think, my first couple months as a county supervisor. I didn't know what the heck I was doing. But I brought this agenda item forward to fund a psychiatric facility here at Tri-City. And it was 6 years ago, so it was lightning speed for government to get this done this quickly. But I remember working with Steve Dietlin and the board at that point in time, and we got it passed, we got it through, and realizing it today with the new board and everything else here is just wonderful. So it's a big day for North County. That this facility represents real progress. It's not just talks. It's not just making plans. It's actually taking action, and the action is what you're going to see here today. So again, I just want to mention a few of the people that are here. We have Mayor Esther Sanchez from Oceanside, Mayor Keith Blackburn, he wasn't able to make it here today, Mayor John Franklin, which right here as well, City Council members that are also part of this, Eric Joyce is here today, and Rick Robinson, both from Oceanside, so I wanted to give them a hand for coming and being a part of this today. So when we first started pushing for this project 6 years ago, I wanted to do more than we were doing at the time for mental health. We needed to build the infrastructure. The county, we didn't have the infrastructure with the facilities that we need today. And we want to get people the help they need. And today that vision became a reality. So the county invested $27 million in this. When I put it through, it was only $17 million 6 years ago. So I'm glad we got it done. In another couple of years, it'll be another, I don't know, $10 million. But anyway, $27 million because we knew how badly we needed these beds. And for too long, people in crisis have been stuck in emergency rooms or in jails. And that's not because most of them are criminals, but because they had nowhere else to go. And unfortunately, our jails are still the #1 place where people get mental health treatment. We need to keep, this is helping to change that, hoping to get the people that need the mental health services. A jail cell is not always not the right place to get that. These types of facilities are, so we can get people back into healing and back into society. So I think the compassionate thing is not leaving people in the streets. It's getting them into treatment and on the path to recovery. So this new facility does exactly that. This is the first county-funded inpatient psychiatric health facility of its kind in our region. It will provide short-term and medium-term care for adults in crisis, people who need help, not handcuffs, and to give them a safe place to stabilize and start treatment. And also gives us, for our law enforcement and our first responders, an additional healing facility so that when they bring people to the crisis stabilization unit or the ERs, there's another place they can go after that instead of back out into the streets. So if we really truly want to solve the mental health crisis, we have to stop confusing compassion with complacency. Real compassion, it comes from taking action, and that's just what this facility represents. Over the past few years, we built out a spectrum of mental health care here in North County. We started with the very first mobile crisis response team was here in North County. I think it was in Oceanside back in 2021. Since then, those teams have handled more than 15,000 referrals across the county, and offering people better situations and offering help before situations spiral into emergencies. We also expanded the crisis stabilization units, with the first one being opened here in Vista, and then another one in Oceanside, at the North Coastal Live Well Center in Oceanside. And together, these facilities have helped over 15,000 people find care and stability. So I want to thank the city councils and the mayors that are here today. It's not always easy accepting a crisis stabilization unit or a psychiatric hospital. It's not always, a comforting thing at first until you realize and you see the help that's being provided and the help that's going to the community. So that there's, sometimes there's a little bit of pushback and say there's a lot of questions in the beginning, but seeing it through to making this happen and make it a reality is just a wonderful. So I want to thank once again the representatives in North County. So this new psychiatric facility, it's a first step. It fills a critical gap in the system, ensuring that when someone needs help, there's a place for them to go, right here in our own community. So we're not just treating symptoms, we're rebuilding lives one person at a time. And we're building a model that prioritizes treatment over punishment, care over chaos, and solutions over sound bites. I'm incredibly, this is very emotional for me here today, to see this come to fruition and making it a reality. So and it's not all me. It was the county staff. It was just, I was a spark, but it was not, everybody that had a hand in this has done a wonderful job to make this a reality. So I'm really incredible of the proud work, and I'm grateful for everyone making this happen, including our partners at Tri-City Medical Center, and especially a board chair, Tracy Younger. And also want to thank you for our entire team and the community for stepping up. It's now our turn to turn it over and share this moment about the hospital's role. I'm sorry, I'm messing this thing up. This is, like I said, this is just wonderful to see this happen. I've been an advocate for treatment and care, getting people into help. I haven't been a fan of parking lots. I haven't been a fan of shelters. I've been a big fan of getting treatment. And that's what we need more of, so that people just don't go recycling back out into our streets. So I'm really happy to. Tracy, I want to thank you and your team for stepping up for this community, and I'll turn it over to you so you can share more about the hospital's role in this effort. Thank you very much.
Well done, Supervisor Desmond. I just have a few thank yous. First of all, good morning, and as board chair of the Tri-City Health Care District, it is my honor to welcome you to the ribbon cutting ceremony for the new behavioral health unit. This is not just a building. This is a fulfillment of a long-held promise to bring back essential, high-quality services to our community. And I want to thank our board of directors for making this a top priority and for your unwavering commitment to this community's well-being. And there's two special people out there today that deserve special recognition. I believe, is Rocky Chavez here? His advocacy, his passion with going to Sacramento really made today a reality. And I think I saw Steve Dietlein, our former CEO. His leadership in securing the county's partnership really laid the groundwork for today's success. So thank you both for your extraordinary efforts. And Dr. Ma, your management team, your dedication and persistence helped make today a reality. And last but not least, a profound thank you to our local county and government officials for your support. Today, you made this building come alive. So thank you so much for being here. And next, I'd like to welcome up the Chief Financial Officer for Exodus. Please come on up and share some words and remarks. Thank you so much.
Hello, good morning, everyone. My name is Kathy Shoemaker. I'm a registered nurse, and I'm the Chief Clinical Officer for Exodus Recovery, and have been involved in many startups with different psychiatric programs throughout Southern California. But I must say, I'm so excited about this one because it's been a long journey to get here, a very long journey, and we've been a part of that journey. And this is the most beautiful facility. I can't wait for you to get inside and see it. It's just gorgeous. And so I'm not going to talk too long at all because I want to, get this, the presentations done and we can get in and see it. I want to thank the previous speakers. They covered a lot of the history and what we plan to do. But as everybody has stated, this is a very, very much needed service in North County. So we are thrilled to be offering and operating these services. We have experience since 2012 in operating psychiatric health facilities in other counties. So we're going to do a great job. And we're going to support the CSUs and the emergency departments. It has just been such a pleasure to work alongside San Diego County and Tri-City Hospital. Everybody's been very responsive. I'm just really looking forward to continued collaboration and making this a fabulous place. We have spent all of last week and this week orienting our staff so we can get open very soon. That's all I can say, very soon. And I am so proud of the staff we have hired. Lots of various good backgrounds, and they're all kind of standing over there, so they're excited to be here too. And so I just want to say thank you so much. I'm so proud to be here representing Exodus in this program today.
Good morning. I'm Scott Chrisman with the Department of General Services at the county. At DGS, we serve our community by building state-of-the-art, efficient buildings for the community members to use. And I'd like to tell you a little bit about this one. DGS, BHS, and Tri-City have been collaborating on this project for several years. Actually, the county leased this property from Tri-City. We built the facility, and now we've leased the facility back to Tri-City to operate. We began construction in late 2022, just before one of the wettest Januaries that I can remember. I think it was almost 6 inches of rain that month, leaving our contractor in quite a muddy situation. But despite that, they were able to dig out the foundations and build this beautiful facility, and now we have a 16-bed, 13,500 square foot brand new mental health facility. Also, due to the building's energy-conscious design and construction, we also achieved a silver rating by the U.S. Green Building Council for leadership in environmental and energy design, or LEED. And doing something like that, as you can imagine, takes a lot of work from a lot of people. I'd like to recognize a few of them now. Canon Design, and if there's anybody here from Canon, please raise. Oh, great. David Hunt. Yes, great. So, under the leadership of David Hunt, Canon Design designed this beautiful facility. And so if you love it, please let us know. And if you don't like it, David is the one responsible for designing this facility. Turner Construction, anybody from Turner here? Oh, Tim, great. Under the leadership of Tim Carter, Turner Construction built this facility. And overseeing the planning and pre-construction for the county was our project manager, Dave Dobson. Sadly, Dave passed away in January of this year, but I have to tell you, he's one of the most dedicated architects I've ever worked with. He had a passion for designing safe mental health facilities just like this one. And then Dave turned the project over to another DGS project manager named Bob Reiter, who oversaw the construction for the county, or from the county's perspective. And Bob did a great job maintaining relationships with Tri-City, with Canon, with Turner Construction, and also with some of the neighbors who became interested in this project as well. So the team did a great job building this facility, and I'm just so thrilled, excited that the community now gets to use it. And with that, I'll turn it over to Mayor John Franklin.
Well, I want to say on behalf of the people of Vista, thank you to all of the partners. But Supervisor Desmond, would you do me the honor of accepting this recognition from the people of Vista on behalf of all the partners here? Supervisor, I want to really thank you. You and I have been working together for a number of years now, beginning with the Crisis Stabilization Unit in Vista, which was the first one in the county, and appreciate your personal leadership to bring mental health services to North County and throughout the county. We see too many people suffering from severe mental illness on the streets of Vista and all throughout North County, and you understand what our firefighters and our police and sheriff's deputies see, which is their work needs to be honored by having the right place to take somebody who is in crisis, and moreover, what the families in our community see, especially the families of children who have severe mental illness and need the correct facilities, which, as you said, is something other than a jail cell. We need the right place to help people. This facility is the beginning of hopefully achieving the vision of SB 43 and truly helping people who have severe mental illness and substance abuse addiction. Thank you for your leadership, and we are looking forward to seeing how this changes the lives of people in North County. Thank you, Supervisor.
Thank you very much. Thanks, John.
Appreciate you.
Okay, hang on. Okay, I wouldn't be a politician without plaques of my own. So thank you very much, John. I appreciate that. You should have given my speech. That was wonderful. But we have certificates of commendation for both Tri-City Medical Center for their efforts in getting this facility open. Hopefully, you're going to hang these proudly in this new facility. And also the Exodus Recovery. They've been a great partner working with the county, working in our crisis stabilization units, and working here. So if we could have Dr. Ma, why don't you come on up here? I'll get this to you. And also for our friend from Exodus, come on up. Come on up. Come on, we got to get a photo up. Come on, come on. Here, come on up. Come on. We'll stand over here.
Jim, thank you very much.
Come on up here, John. Come on. Thank you. Here, John, come on up. Oh, cool. Esther, come on up. Come on, Mayor. Mayor. Come on. All right.
Sorry, I don't have
we
a
gotta get-
certificate.
I'll share. We'll hold this one in front of you.
Thank
All right,
you.
Thank you.
Thank you, Brian.
All right, thank you, everybody. So in a few minutes, we'll invite you to do a tour of this new facility for whoever wants to. Before that, though, we will have everybody join us for the ribbon cutting. And then if there's any members of the media here, we would be happy to do any one-on-one interviews. But that's all for today, so thank you all for coming.
All right, where's Jim? Get in here, Kathy. Does anyone see the surprise? Oh, there's fabulous.
Get in there, Jim. All right, come on up here, Rick. Golden scissors.
All right. And then where's Tracy or Dr. Mom?
These are yeah, you're not getting this one.
Okay, so what we're gonna do is I'm gonna go 1, 2, 3.
Dr. Ma early.
3.
Dr. Ma!
Yes, I'm getting him.
Dr. Ma, come on up. Where's the scalpel or something? That black. Come on.
Using the ideas that I have this canvas to trace it. Yes.
But please stand up there. Thank you. Okay, friends. So on
We're not
3.
cutting a rug, we're cutting a ribbon, right? Okay, that's for the
Yes.
gala.
Oh, yeah, there you
So
go.
on 3 we will cut. Ready? 1, 2, 3. Woo!